What's up guys, Dr. Mo here with Expat Health. Welcome to another video. So today we're going to be talking about second medical opinions. Now, I hope you never find yourself in this situation, but commonly, unfortunately, when we're abroad, we have to think through these things and we have to plan for them and we have to figure out what we're going to do. Classically, you're going to find yourself abroad and you're going to have a particular injury, maybe something acute, and something that might need surgery. So for example, you might have uterine prolapse, you might have an ACL tear, you might have a herniated disc, you might have something on your eye, and you are faced with possibly getting surgery. Now, initially when you're dealing with the acute phase, you might go in and out of the urgent care and emergency room, go to a primary care doctor, and then you find yourself in front of a surgeon, right? Now the surgeon says, hey, these hemorrhoids are really bad. I recommend cutting, I recommend some sort of a procedure, and you're petrified. You're like, no, I don't want to do that. And so you start facing the main problem, which is sometimes, as a doctor, you believe that the procedure that you're going to do is quite helpful and it is quite effective, right? Because if you're a surgeon, if you're a hammer, everything looks like a nail. But I think if you're a surgeon and you know how to take care of something with surgery, well, that is probably what you're going to recommend. And don't forget, surgeons are also sometimes incentivized to do the surgery because there's also money in it. They're going to make more money. Now, we like to think that this must be a very bad person who's thinking about their income and finances, but that's not the way it works. As a human being, you have inherent biases, and a bias generally is something that you're not aware of, and you're going to make decisions based on that, and it affects people in different ways. So how do you protect against that, right? So number one is you go get a second opinion. So for example, let's say you're dealing with a really bad thrombosed hemorrhoid or rectal prolapse, and something really uncomfortable that you're acutely dealing with. Well, of course, you're going to go to this person initially and have them help you manage the acute phase of this. Once they help you through the acute phase, you now can decide, do I need surgery? Do I not need surgery? The knowledge gap in the beginning is going to be really bad, right? Here's the surgeon with all that information. Here's you at the bottom. The closer you guys can get to it, the more questions you can ask, the more research you can do, the closer you're going to get to that person's knowledge base. Now, unfortunately, doing Google research and doing online research is often, I would say it's probably actually more problematic than anything else, because it's going to lead you astray. You're going to have certain ideas and thoughts, and you're like, oh, that's got to be correct. I must be going down the right path. But in reality, it's complicating things. So usually I suggest that my own patients use Google and any kind of online research to just get some background information as like, what does the surgeon know? What is the terminology? What are the things that they're thinking? Not so much for you to try to self-diagnose, not so much for you to try to determine which procedure is best for you, and not even for you to think about like, what are the worst case scenarios and best case scenarios. Even that is something that the surgeon themselves is probably going to have the most amount of insight on. However, what you can do now, you can ask the right questions, and when they say something, you can say, oh, so the reason you're considering this is because of this, but what about that, right? So now all of a sudden the questions that you guys are asking is in the much more even playing field, and you're going to get better answers, and you're going to be able to communicate with that surgeon much better. The next problem, the next issue to consider is, well, as a patient and as a doctor, if you're going to go behind this doctor's back and get a second opinion, what happens? What are they going to be upset? Are they going to be mad? By the way, I hope you guys are enjoying this beautiful background that I picked here. This is Santiago de Compostela, Vista Alegre Park. Sun's coming out. It's winter. Just beautiful. It's not almost winter. Just beautiful. So now, a good surgeon, a good doctor, a good physician will never be upset, will never be mad at you going and getting another opinion. Remember that. A good surgeon will never be upset. In fact, they're going to encourage you to do it. So imagine you're going in and you need a coronary artery bypass graft for your heart or a stent in the heart, and the first interventional cardiologist says, I think this is what you need. This is probably the best way to move forward. That's scary. You're like, I don't really want to do that. What do I do here? They might even recommend, why don't you go see one of my colleagues and see what they say? They might recommend even a regular cardiologist. Now you have an overlapping opinion. The same way a gastroenterologist might deal with thrombosed hemorrhoids and a proctologist will deal with it. Now remember, a proctologist is a surgeon and a GI doctor is not a surgeon. So now if you can get these two different people who have overlap in their field to give you an opinion on your situation, you can get a non-surgical and a surgical approach idea. And that's going to be helpful because now you can decide, do you want the surgery? Do I want to deal with the complications of surgery? Maybe there's no complications of surgery. Maybe surgery is the best option, right? And the same way with a cardiologist. So you have a cardiothoracic surgeon and you have a regular cardiologist. The regular cardiologist is mostly going to manage you with medications and interventions, but they're not going to be able to put a stent in your heart. That's an interventional cardiologist and sometimes an interventional radiologist. So now you can get an opinion from a regular cardiologist or even a really good internal medicine doctor, and now compare these different opinions. Do you still need surgery? Is surgery the best option? And you can now take that information back to the first doctor and say, hey, I went and got some other opinions. I wanted to ask you some other questions. Of course, if that first surgeon, that first doctor is kind of upset, maybe giving you a little bit of a hard time, that's probably not the kind of person you want to go to. That's not the right kind of doctor. You want the kind of doctor who can say, great, I'm so happy you went and saw Mrs. Smith, Dr. Smith, and now we have some more information. It sounds like they thought it's this. I still really think it's that. Listen, why don't we try this and see if we can tease it out? And here are your options. And you always want the kind of surgeon, the kind of doctor who's willing to quickly change their opinion based on new data, based on new information, based on the change of their initial impression. The patient first comes to me and I'm like, oh my God, this situation is really, really bad. And then when I reevaluate them, I'm like, actually, it's not as bad as I thought. Now taking a look at it, it looks like it might be this. Why don't we try this? Why don't we change direction, change course? This is a clinician, a physician who's thinking intensively, who is really evaluating data. Critical thinking in medicine is the art of medicine. The art of medicine means meeting the patient where they are, using the resources available to make the best decision for that person, and not just pushing our own ideals or even our own biases on that person. So I hope this is helpful. This is a little bit about getting a second medical opinion. Of course, I'll create some other content about maybe the logistics of getting a second medical opinion. Some of it is going to be about utilizing telemedicine, virtual medicine, finding people who are experts in a topic and having some good discussions. If you have any questions, check out my website at digitalnomadhealth.com. If you're interested in working with me, you can go over there, sign up, and I'd love for you to be my patient. Take care, guys.